Today is the World Stroke Day, the day that is observed to raise awareness on prevention and treatment of a disease that is the second leading cause of death and a major cause of disability worldwide. I am Kamal Narayan, CEO of Integrated Health and Wellbeing Council, India's premier institution for health awareness, advocacy, and behavior change. And it's my pleasure to connect with all of you today for the second edition of Stroke Summit on this special day of World Stroke Day. Stroke, what is generally known as lakwa in many parts of our country, is a major problem in India as over 18 lakh people suffer from this annually. That means every 40 seconds, someone suffers a stroke, and every 4 minutes, someone dies of stroke in India. This also leaves many disabled for life. As per a Lancet journal, stroke is the second leading cause of death after heart attacks. But despite stroke being a serious disease that can have disastrous consequences for those affected, as well as on families in terms of medical and economic burden, it has very low awareness if compared against the much talked about heart attacks. Very few people know that, like our heart, our brain too can experience an attack, and this can be equally fatal or debilitating. Stroke is an emergency, and timely administration of effective treatment within 4.5 hours of symptoms onset can save life. IHW Council took up the mission of creating greater awareness among people about stroke and advocating for enabling our healthcare system for better support and preparedness. And this journey began with the first stroke summit last year that brought the unprecedented focus on stroke awareness and care in our country. Before we move ahead with a very esteemed guest today with us, let us have a glimpse of what happened in the first stroke summit in 2019.
As the mnemonic, B-E-F-A-S. B stands for sudden onset of balance problem. So suddenly somebody gets a balance issue. Eye problem, one eye or both eyes or one side of the eye one can't see. Sudden blindness in one eye or both eyes. Fast is if there is a face crooked. So if you are smiling and the face is turning to one side, that's F. A is if you raise your arms and one arm is drifting down. That's an arm drift. And speech is if the speech is unclear, dysarthric, slurred, or it's not making sense. The words are not coming out well. So if you anybody has a BEFAS symptom, they are likely to have a stroke, and they should immediately not waste time and rush to a stroke hospital.
So there are two major challenges. One is the lack of awareness among the public, even among physicians and doctors. Number two is the lack of stroke infrastructure or stroke care services for patients who have a stroke, where to go and how they get treated.
Summits like these, like we have the Stroke Summit today, is really the need of the hour, because to fight stroke, to make India stroke ready, to make India ultimately stroke free, You need awareness. You need awareness amongst the public to be able to know what's causing stroke, to be able to prevent them, and if one has a stroke, to reach out in time for management, also to make the healthcare delivery system stroke ready.
Thank you. So these were some of the glimpses of what happened in the first edition of Stroke Summit. The time in which the second edition of Stroke Summit is taking place makes this all the more important. The ongoing pandemic has significantly impacted stroke care in India, as it has done for almost every other health issue. Today, we have a great panel consisting of eminent neurologists and stroke care experts and advocates of stroke care in our country. And I'm sure that collectively we shall be able to bring back the focus on stroke during the pandemic and beyond it. So let me introduce our esteemed guest today. We have with us Dr. M.V. Padma Srivastav. She is the professor and head in the Department of Neurology and also Chief of Neurosciences Center in All India Institute of Medical Sciences, New Delhi. Dr. Srivastav is Padma Shri awardee and one of the most passionate champion of the cause of stroke care in our country. She is also known for pioneering Acute stroke program, which is also called Code Red, a medical initiative for supporting patients afflicted with epilepsy and stroke. Under her leadership, AIMS became the first public sector hospital to launch this program. We also have a very senior and veteran Professor Dr. Sudhir V. Shah, Head Department of Neurology at Srimati NHL Municipal Medical College and Director of Neurosciences in Sterling Hospital in Ahmedabad. Also, Padma Shri awardee Dr. Shah is among the top neurologists of our country and is also known for his research on brain cells and much acclaimed books on neurology. He has served as the honorary neurologist to the Governor of Gujarat. So welcome, Dr. Padma and Dr. Satish. We also have Dr. Sudhir. We also have Dr. Bindu Menon, Professor and HOD Neurology, Apollo Specialty Hospitals, Nellore. Dr. Menon is one of the leading neurologists in Nellore. Prior to Apollo, she was associated with Narayana Medical College and Super Specialty Hospital as a professor and head of the Department of Neurology. Welcome, Dr. Bindu, to this program. Dr. Satish Kumar, our another important guest for this session. He is a senior consultant neurophysician in charge stroke program and stroke prevention clinic at Gleneagles Global Hospital in Chennai. Dr. Satish is experienced in handling the management of acute stroke, including thrombolysis and interventions. He is an active member of various learned societies like Neurological Society of India, Indian Academy of Neurology, American Association of Neurology, and American Stroke Association, among others. So welcome welcome all of you on this a very special program today, which we are hosting on the World Stroke Day. And the topic which we will be discussing with this panel of very veteran doctors and experts is the stroke awareness, symptoms, precautions, and rehabilitation. And this is a very, very essential need to make India stroke ready, as Dr. M.V. Padma mentioned in one of her video messages. So let me begin with this. So, with as Dr. Sudhir, mentioned that the ladies who are leading the whole fight of stroke in our country. So let me begin with Dr. Padma, who has been a very, very vocal champion of stroke care and improving the whole infrastructure to support and make India stroke free. So, Dr. Padma, to begin with, because this is a awareness summit, and this will be watched and is being watched by many people from across the society. The people who come, who are general public. So, I would like you to share that what is a stroke and what happens when one gets a stroke. Something how people can get to know that they are experiencing a stroke.
Thank you, Mr. Narayan. And I think you actually are the best advocacy person. In fact, what you have summed up in the beginning of the session, more or less is probably the synopsis of the whole, the message that needs to go across. So you very rightly put in fact, I really like the way you put this, that just like a heart can have an attack, brain can also have an attack. And that's a message I suppose should go down, beyond the medical personnel and even amongst the paramedical personnel, that it is the sudden stoppage of blood supply to the heart which has an attack, and sudden stoppage of blood supply to the brain is a brain attack, whether there is a clot in the blood vessel or the vessel breaks and there's a bleeding. And in fact, they say my heart bleeds, but there's never a bleeding in the heart. The bleed happens in the brain. So it is a sudden stoppage of blood supply to the brain is a brain attack, and therefore that's an attack. Attack means it's an emergency. Obviously, when there is an attack, there is the defense that has to be mounted, has to be in a really, really expeditious way, the way it's a war footing, because it's an emergency and it's an attack. It's hamla hai, so you need to mount that. And the reason for that is because every moment, in fact, they say is every minute that there is no blood supply, it's 1.9 million neurons are lost forever. So if you actually calculate, it's like several light years that probably the distance that can be covered. So it is, and the brain which is lost is not retrieved. Really, whatever brain plasticity or whatever research we have, we don't have a brain transplant yet. So don't even go into it. So we can't afford to lose the brain. Said that, again, you said, how do you recognize? I think Vinith in that talked about be fast. Fast was the first mnemonic which came in, F-A-S-T, wherein there is a sudden loss of a brain function, and all those functions that we take for granted. We talk, we see, we channelize our thoughts, we choose the words, we move our hands, we are walking, everything, our consciousness is all taken for granted. And if the brain doesn't function, one of these functions is just lost, and it is sudden. So the crux there is it's a sudden loss and a brain function is lost. So therefore, commonest was that there's a facial droop, there's a problem in your, weakness of the arm and the speech. That's why it was fast, and the T was for time, because you factored in that so that people know that time is brain. However, it was not picking up everything, so it became be fast, which essentially brought in a vision and brought in some balance. And there are several other things which have evolved in the world. And one of the latest which is coming up, which is probably going to get published soon, is Save Me. It is another mnemonic. And in fact, that sort of, they thought that it is emotionally a little more tangible, a little more connect to people, because it says Save Me, S-A-V-E-M-E. Essentially listing out the components which you can see and feel and realize it's an attack. So unlike a chest pain and breathlessness and sweating, here you're talking about a sudden loss of a vision, sudden facial droop, sudden loss of speech, sudden speech which is gibberish, sudden loss of balance, and of course the one which is most frequently associated is a sudden paralysis or loss of function of one side of the body. But it will also be sudden loss of consciousness, slippage into coma, sudden splitting headache, even a seizure. Any of this suddenly which is lost is a brain attack. It's easy to pick up, And in fact, if you're aware, one can do pick up. But I'm sure you would be talking about stroke mimics with the panelists as to what are those things which sometimes people think it's not a stroke and it actually is a stroke. So that's where we are about what stroke is and how you pick up that it could be a stroke.
Thank you so much, Dr. Padma. This be fast, it's definitely something which I think the message of being fast has to reach to everyone so that they can identify and act on when the occurrence of a stroke happens. We will be coming back to you to understand more on it. Let me go to Dr. V. Sudhir. Dr. Sudhir, you are a veteran in this field. What is the prevalence of stroke cases in our country? I mentioned about some numbers, but I think there must maybe something more to talk on it. And if you put some kind of light on that.
Thank you, Kamal, for your question. And according to WHO, there are about, I think, 15 million people who suffer from stroke worldwide. Out of that, it is said that around 1.1 or 2 million may be in India. And that is for the new stroke, out of which, if we talk of the world first, 5 million people die within few days. 5 million people suffer from disability, and 5 million are having, they go back to the work with some or minor difficulties. Now, this number is now revised, and it is come to about 18 million. So that is slightly a revision. In India also, we don't have exact data, but could be somewhere around 1.2 million. According to one count, about 55 million people had stroke in their lifetime, and someone had a brain attack every 33 seconds, and someone dies of a stroke every 3 minutes in the world. In India, it is said that around 5,000 strokes occur a day. So you can understand at every 1 hour how many strokes would be occurring. And out of them, as usual, 1/3 die, 1/3 have permanent disability. It is said that about 7,200 crore of budget goes to the stroke care in India. So it's a very massive data. And, we have to literally work very hard because stroke is mainly a preventable disease. And today we'll be discussing how, I think I'm supposed to answer that question, how best we can attack the risk factors and prevent stroke, where I will take this little more further. It will be more relevant.
I'll come back to you on that question, sir. But the important point you are highlighting, that 5,000 stroke cases happening in our country in a day, that's a big number. That's a massive number in that way. And, keeping in mind that, this can have an impact throughout the life of the patient if there is a disability, which not only on the patient, but the whole family. This is something which need to be taken on really effectively. Let me go to another lady in our panel, actually. So, Dr. Bindu, 5,000 cases, such a massive repercussion on life. Still, and I think some cases it is much more graver or serious than heart attack itself, because as Dr. Padma said, that the loss which happened in your brain, it may not be kind of compensated or recreated. Why do we have such a lack of awareness about something so serious in our country, and when it compared to something like heart attack?
Thank you very much, Mr. Narayan, and I think I should appreciate the force which you are taking forward for the awareness about stroke. Now, as we heard from both of us panelists earlier, stroke is posing a major health threat to the country, globally as well, and to the country as well. And I would say it is in 3 spheres, if one would look at it. One is when we look at it as a mortality, that is a death related to the stroke. Second is the morbidity, that is the sufferings which the patient has. And as rightly pointed out, it's not only the patient who suffers, the whole family suffers if the person has a stroke in the, somebody has a stroke in the family. And then obviously the socioeconomic burden which the stroke has in it. Now we heard that there are 5,000 stroke cases in a day, and that's a huge number. There is every 40 seconds, you mentioned it in your talk, that there are 40 seconds somebody has a stroke, and every 4 minutes somebody dies of a stroke. And then rightly, why is stroke not having the due importance of care and the emergency? And the word itself, as Dr. Padma said, it's a stroke. You need to hit hard. Why is it not having? There are a multitude of reasons for that. One is that from the ages ago, it has been thought that stroke does not cause death, but heart attack causes death. That is why a person is rushed to the hospital. When a person has a heart attack, he keeps his hand on the chest and he rushed to the hospital. Heart attack, that can cause death. And death is fearsome, you know, death is fearsome. The other things can't probably be dealt with is what is thought. But we're not understanding that apart from the death that has been mentioned, the life-changing, the disability which the patient has is much more than a person can have a death. The stroke and the burden which a person has and the family has, all of us as stroke specialists, it's much more, it's too much that a person and a family can bear. So that is one reason which is not receiving, but we should be telling the public that stroke can cause death. And in fact, that is one very important reason. The second reason is that the stroke is predominantly and essentially painless, you know, except for one headache pain, which is one of the symptoms of stroke. Essentially, it's painless. And we all of us know pain is one symptom that makes the person rush to the emergency. You know, if I have pain or anybody has pain, you seek attention. If you don't have pain, you become a little lethargic, saying that, yeah, I can go tomorrow, I'll see, let me take it. It's, you know, pain pushes the person, chest pain is there, but unfortunately, when a brain has an attack, it doesn't cause pain. In a few sectors, it causes pain in few cases. Then as Dr. Padma said, the mnemonic keeps changing. Why is the mnemonic changing? Because the number of symptoms of stroke are multitude, you know. It was fast, then it became be fast, then it became save me. You know, it starts from the eye, the hand, the leg, the vision, the speech, the swallowing. And certain of the symptoms are away from the area of the organ, like chest, heart pain, it is here. But brain, how can a person in a village attribute a grip weakness to a brain attack? So our awareness program should be as robust to tell them that these are the symptoms, these are the mnemonics. Probably suggested way is that you have some mnemonic in the vernacular language like we did it in our Telugu language so that we reach the public in a better manner. And lastly, people do not understand, over decades, we have made a sea change in the treatment. Like heart attack, that there is a sea change. Now we have thrombolytic therapy, we have endovascular therapy in which almost 30% of people's symptoms can be reversed back, we can cure, and we can get the patient back to. So it's not only dil se socho, dimag se socho, you know. Dimag bhi utna jaruri hai jitna dil jaruri hai. Both are equally important. Both should be treated with the same time, and time is brain. Time is being saved.
Time is brain, and I think sometimes the brain should take precedence on the heart. So yeah, so the more than dil se socho, dimag se socho is also very, very important. I think more than that. And the one part which you highlighted, Dr. Bindu, is very, very important. That I think the absence of pain is something which, you know, kind of delays the whole, reaction of the people towards seeking the medical help. We are doing a major awareness campaign in this month about breast cancer, and one of the case a doctor shared that despite having a very big lump in breast, one of the patient, she reached to a hospital on a very advanced stage, and when she was asked, despite having lump, why didn't she seek help? So the answer was because there was no pain.
Absolutely.
So if you don't have pain, then it become a, you start taking it lightly. Dr. Satish, you have, worked, I think, parts of UP also, and you studied in GSVM Kanpur.
Yeah.
As Dr. Bindu said, that many times in rural areas, we don't correlate stroke with brain. So when somebody gets, kind of a paralytic attack, people start doing, massaging and other thing, and they feel that it is only in the hand. There is nothing, or it is only in the feet. How do you see that situation? And, how common is the stroke? I see, stroke being really common in our rural areas. So what is your, perspective on it?
Sure. So at the onset, I immensely congratulate you and for this creating a stroke awareness campaign in every stroke summit. So the question is very vital. I think since we are all living in low and middle income countries in the world. So India being one of the low and middle income countries. So the incidence of strokes are very high, and we get more strokes in the rural areas than in urban areas. However, most of the acute stroke units, acute treatment protocols, and rehabilitation centers are only predominantly available and clustered in urban cities and corporate hospitals and tertiary care institutes. There is a lot of mismatch treatment gap between where the strokes are happening and where the concentration about the management. So as Dr. Bindu clearly told that, it's not clearly no awareness to the public. They don't even know when the stroke happens, and sometimes they may not even come for more than 1 or 2 days also, because they are not aware about what a stroke is and how the stroke symptoms are, and they may miss out the vital opportunity to reverse the stroke symptoms. In rural area, we are getting more strokes. So if you consider, Dr. Sudhir Shah sir already told about the incidents, we are getting approximately in India around 1.5 million strokes a year, and it will come around some 4,000 to 5,000 strokes a day. And that is almost equivalent to, we can say, the crashing of 10 to 15 Boeing jets in our country every day. So these facts of Indian stroke statistics in rural areas are quite alarming, and we all know it is a second commonest killer disease. And in India, every 3 minutes in rural countries, somebody has strokes, and it counts to 1.2% of deaths in India. So rural deaths of stroke are most vital. There are a lot of practices. People think, yes, as rightly told Mr. Narayan, they think that this is because of some compression they slept off. People think that massaging and some form of oil massage, and there are some rare insane practices I have been witnessing in Chandigarh too, where they will try to use, they will give cannabinoids, that bong they will give with either in the solution form or in the powder form. Then they think that it improves stroke outcomes as well as cardiac outcomes too. In some remote part of Tamil Nadu, there are people who give some form of blood from some birds on the paralyzed limbs. That they think that when you apply this blood, the blood flow increases and the stroke symptoms recover. And there are some rural practices. I think Dr. Bindu also will know about. There are some Ayurvedic practices, some form of cocktail therapies available in Hyderabad, in Telangana, where there are people who rush to these practices, ignoring all the medical facilities in the coast. So it's a real challenge. Lack of awareness is one challenge. Even in India, there are a lot of rural strokes, and we don't have proper dedicated stroke centers in rural areas to meet these needs.
Dr. Satish, you said that the specialized care centers are all concentrated in urban areas. Rural areas, we have all these kind of practices where you will get treatment for everything, but none of that treatment will reach to the brain where the problem is in terms of stroke.
Absolutely.
You will get all kind of oils and massages and Ayurvedic practices.
Hi, good morning.
How people, let's say, be in rural area or urban area or in between, can find out right stroke unit center. Let's say, even if this awareness, which is Dr. Bindu is doing in Telugu, multiple stakeholders are doing in multiple languages. If this awareness reaches, how do they find out where to go?
So it's again, it's a challenging task, because we don't, unlike developed countries in India, we don't have integrated healthcare system for stroke. So it's all in bits and pieces. We can say almost, even in the best and best of tertiary institutes and cities, we have almost 100 centers of stroke, which can do comprehensive stroke center, and there are some 50 to 75 primary stroke centers. And we need more and more, in thousands, in lakhs, to cater this population. And but what, apart from the awareness, what the next need is, people should aware about what is the use of stroke center, what is the use of stroke unit, and why stroke centers and stroke units are important in the management of acute stroke care. Because stroke, as clearly pointed out from Dr. Padma and Dr. Bindu Menon, is that it has multitude of functions and multitude of complexity involved. So you can't treat the same protocols for a minor stroke and a large stroke in the same window period. So we need a primary stroke unit where the basic routine intravenous thrombolytics works, where even with the help of primary health center where there is a CT scan facility, they can go nearby without wasting much time to shifting the patient to the corporate center or the cities. So primary stroke center has an immense role in rural centers for acute management of stroke. We call it as acute stroke ready hospitals, whether it is a PHC or a government sector or it is in a private sector. But once the stroke complexity increases, like, you need large vessel occlusion, where you need more cath lab procedures to remove the clot, or you need a dedicated stroke unit which needs intensive care, preventing stroke complications, and multiple of rehabilitation centers therapies are needed. So you need to shift the patient to the comprehensive stroke centers, where after the immediate acute care, they can shift the patient to the nearest comprehensive stroke centers. But actually, the government is focusing on not only this public awareness, early diagnosis and management. And I think the need of the hour is an organized effort from both the government, whether it is a government sector or the private sector, as well as from the public, to know about what is a stroke, how to treat an acute stroke window, and how to prevent a stroke by knowing the risk factors. And that is, we all know it is a silent stroke epidemic in our country.
Thank you, Dr. Satish. Dr. Padma, if I come back to you on this, you are heading, one of the best center of excellence in the best hospital or the biggest hospital of this country, which is from the government sector, and which is the part of our public health system. I think the best example of a public health system, facility. What about people, and the question I asked to Dr. Satish also, that people in rural area, like for example, my father got a stroke and he was around 150 kilometers from Kanpur, which is, let's say, a place in Bundelkhand. Now there is only one primary health center at that place. They don't know that how to react to stroke, and by the time I think they took it to some other place, some of the damage was already caused. So what as per you, the system we have, and how the government, or let's say advocates like you or the stakeholders are like you are helping in training more doctors for this? Dr. Padma, you are on mute.
Dr. Padma, are you able to hear me?
No, she can hear. I think she wants somebody to call her.
Mute है. She unmute करो उसको. Center से unmute करो.
Yeah, now I'm okay. Your center had muted me and it was not allowing me to unmute. Okay.
Himani, please be careful.
Sorry, yes. Okay, no problem. So it's a very, very relevant question. In fact, like, what we, we have a hierarchical system of healthcare delivery in India. We have a 3-tier. We have, as Dr. Satish said, there's a primary, there's a secondary, and there's a tertiary level. And you have the primary and the secondary catering to nearly 70% of the geographical population, which includes a lot of rural and semi-urban areas. And you have this clustering, as Dr. Satish very rightly said, you have clustering of the, the 5-star facilities, which are all there in the metros. You have, but even if you take Delhi per se, you take metros, there's a difference between Delhi in Trivandrum in Mumbai, in Chennai, or even Bhopal. There's a difference in Uttar Pradesh, Kerala, Punjab, Haryana. Now, Kerala, I feel, is a different country by itself. So you see, you cannot actually, you can't compare these areas which are distinctly different in their social, economic, and geographic barriers, leave alone ethnicity and as well as their practices of living and the food and everything else. Northeast is a different belt. Northeast has 50% bleeds and not even ischemic zone. So they have a different take altogether. Said that, what we need is a stroke map and certification of those stroke-ready centers. As Dr. Satish said, you have a primary center. What can be done at a primary center? Now, a primary center, don't expect a neurologist and even an MD physician there. But you have the wellness clinics. So what you have is a prevention program and a rehab program. And you can easily pick up strokes and you have a guide map up to what are those conditions wherein you can refer to a particular place. And there is a map and a connect. So these are all hub and spoke wheels. But at a district level, the workhorse is a plain CT scan. And a lot of our states have a CT scan available in their district hospitals. So what we did there is, again, not the neurologists. We barely have 2,500 neurologists for a 1.35 billion population. It's no brainer that is a neurologist is not the one who's going to manage strokes. It has to be physicians and they need to come into the ambit. So we've definitely designed those, like monkey-proof SOPs, which can be emulated and followed in an emergency setting where an emergency doctor deals with a delivery, deals with a trauma, deals with a heart attack. Why not a brain attack? So you have those SOPs in place. And also, as a government initiative, make the mandatory stuff free. And we're trying to actually get in this package into the Ayushman package 2. Then we're going to push it through Ayushman package 3. If you see, stroke is not included in that. So, you need to, but fortunately, altered place and tenured place is part of emergency system, essential medicine. It is free of cost in a lot of district hospitals in different states. So you have it on the shelf, have your SOPs and train the physicians of manning emergencies. At district level, IVT is possible. And what else is possible? An SOP where you can transfer to another hub where they stay connected. This worked on a telestroke WhatsApp model in Himachal, in Punjab, in Kerala, Rajasthan, parts of UP. Dayasagar is, you have him on a panel. He is part of that hub and spoke wheel we have in Uttar Pradesh. So that's possible and it's running. And then at a tertiary center, what can be done? There, I believe that you need to probably have a lot of public-private partnerships, which are trust, which are based on trust. You can't say that everything private is seen with suspicion and everything public has to be. It can't be that. And you can't have an L1 for everything. You need to have those trustworthy partnerships for a common goal. And, I'm sure you agree with me. Health should be a state property. I mean, when I'm born into a country, I don't need to be bothered if I'm sick, where do I go? So that kind of a thing, we need to get into that goal. It's doable. So you need SOPs and not just policy and adaptation. You need implementation and an audit of those performance measures. A lot of time, energy is gone and expenditure in designing a policy. So they lift different task forces, different stakeholders that don't see eye to eye. That's not the way it should work. You need a pyramid, okay, but then they need to be connected. And it has to be, I think, a lot of emphasis on implementation of that design or adaptation of the policy and have performance measures with defined timelines. We can do it.
Thank you so much, Dr. Padma. Actually, this is very important. I am sure that with these SOPs and with this, the point which you are making, that the neurologist alone cannot help, address the problem of stroke in this country, and the general physician, the other health, professionals, paramedics, all has to, I think, be part of this whole process. So now we are, kind of running a little late, but quickly I will have two more, comments. So Dr. Sudhir, you mentioned in your remark that stroke is preventable. What are the risk factors actually, and how we can work on preventing stroke?
I think for today's webinar, the most relevant question for public is this, because my best emphasis is prevention is better than cure, and stroke you will be surprised 80 to 90% of strokes are totally preventable. The major risk factors are hypertension, lipids, high lipid levels, smoking and tobacco chewing, diabetes, atrial fibrillation from the heart, there is irregular heartbeat, and sedentary lifestyle and central obesity. These alone, if we can control, about 80% of strokes can be prevented. As for example, hypertension alone contributes to around 35 to 40% of strokes, let alone strokes. Even the myocardial infarctions, 40% are due to hypertension. So if one regularly checks the blood pressure and takes the medication regularly without fail, and they don't stop even if the blood pressure becomes normal, I think that message is the most crucial message for today's day. Alone blood pressure can control 40% of stroke. Smoking, tobacco, alcohol and cocaine, etc. Drug abuse also is a very important risk factor. Lipid level, high lipid is a very important risk factor which is totally preventable. Check it, treat it and prevent it. Similarly, atrial fibrillation, diabetes, these two are, for by regular checkup and proper control of is perfectly treatable. You will be surprised that in countries like Canada, the government has removed the common salt bottles from the restaurant. Just by adding extra salt on the food, your blood pressure rises by 10 to 15 millimeter of mercury. So just remove that and you're fine. Similarly, countries which produce maximum dairy products like Finland, etc., they have removed all dairy products from the routine food, though they sell it. So ghee, butter, oil, etc., should be reduced in food. And you'll be surprised, a single cigarette smoking causes reduction of lifespan by 3 to 5 minutes of a life. If a man is smoking at the age of 15 years, and if we ask him to stop by the age of 20 years, we add 9 years of his life. So these are the major contributory factors. And why not we, because in a country like ours, they were all telling Madam and Satishan, creating the infrastructure and creating awareness. Out of this, awareness is a rather cheaper aspect. Infrastructure will take its own time and we have to do it, no doubt about it. But awareness by such conferences, webinars, and producing lots of TV discussions and writing down books and pamphlets and everything should be dissipated across the country. And central obesity, reduction of the abdominal fat, doing regular exercise, all these matter a lot. And of course, oral contraceptive, certain pills should not be given to the ladies unnecessarily. And certain factors like thickening of blood and homocysteine should be checked. Put together all 90% of stroke, write it down, can be totally prevented. So
Thank you so much, Dr. Sudhir. This is very, very important message, I think. If you are saying 80%, 90% of the stroke, I think out of 5,000 cases which we are seeing every day, almost maybe 4,000 can be reduced, 4,500 can be reduced. So I think that is the message should reach to the people. And if, only this message of that hypertension itself can reduce 40%, up to 40% of the stroke, and people start understanding that and start looking forward for, and following prevention will help a lot. So I'm sure that that message will go far and wide and to make people seek this behavior. Dr. Bindu, last remark from your side. Those who have already got a stroke, what are the rehabilitation processes for them, and how we can expect them to come back to their optimum life?
Thank you, Mr. Narayana, not to leave away that rehabilitation part, which is usually left away by the patient as well as by the caregivers. Now, stroke is catastrophic. Stroke is devastating. So the stroke management is a continuum of care. Now, as we heard, it starts from the prevention, then it starts with the acute stroke care with thrombolytic therapy, endovascular therapy, stroke unit, stroke ICU care, everything. From there, when the patient has been stabilized, then is then starts the recovery process, and that is what we call rehabilitation process. So even with the best of stroke units and the best of stroke cares, we know that 30% and above can make probably a recovery rate from the thrombolytic, but there are a huge number of patients, I would say around 50% of patients who completely do not recover, and then the tempo of recovery still continues. So what is stroke rehabilitation is trying to teach the patient, and that is to relearn what the patient has already lost. It could be a grip weakness, it could be the way he walks, it could be the way he talks, it could be the way he swallows, the visual, everything. So it needs to be customized. So customized is that it's not a blanket therapy that we give to everybody. And all of us would agree to it that a continuous and progressive customized physiotherapy care, which includes a physiotherapy, which includes an occupational therapy, which includes a speech therapist, which includes a psychotherapist, everything amalgamated, put together, only helps even if the acute stroke care has been in place. If this doesn't happen, then the continuum of care doesn't happen. That is why even in this COVID-19 times, we have seen that most of the patients have stopped going to the physiotherapist. The physiotherapist has to stop going to the patient's house, but then it is very important that we learn whatever we had there. It should be continuum of care should be there. And it is important because progressive and customized care to the patient continues to give the improvement. It doesn't stop there. Also, if the person continues to have the physiotherapy, he can wade away from certain other factors like pain. There is a shoulder pain, there is a shoulder arthritis, develops a frozen shoulder, patient develops a spasticity, the patient's hands and legs become very stiff, because of which he does not agree to the physiotherapy, does not comply to the physiotherapy. And we can wade away from several other complications apart from having the stroke improvement at all. Part of continuum care should always be maintained.
Thank you so much, Dr. Bindu, for highlighting this aspect also, because this is where we can help those who have already got stroke regain their the normal life by providing customized and effective rehabilitation, which is also need to be seriously looked into, and we need to prepare for it. So here we come to the end of our inaugural session of Stroke Summit 2020. We will try to dig deeper to understand and identify a roadmap on how India can be made stroke ready to ensure maximum lives are saved, and also how we can make more people seek a healthier behavior which helps them prevent stroke. As Dr. Sudhir said, that almost 80% of it can be prevented, and like this many other diseases can be prevented. So we are now being joined with a host of veteran strokeologists from across India for the next panel, and I welcome my colleague and seasoned PR professional media professional Anisha Nair Dhawan, who will be hosting the next session. So with this, thank you so much, Dr. Bindu, Dr. Sudhir, Dr. Padma, and Dr. Satish for your time and joining us for this important initiative and helping us taking the information awareness about stroke to the people of our country. Thank you so much for joining us. Anisha, over to you for the next session, and sorry for getting late again as usual.
It's all right. Thank you so much, Kamal, because it has been, an eye-opener for all of us to see that, stroke is something which can have devastating consequences, but there are ways to prevent it. So what we're going to do today is that in this session, we are going to hear from doctors on how they treated the patients who presented themselves in case of a stroke. We will also hear it from survivors, those who had a stroke, have survived and are thriving today, and what they want to say to people who are viewing this conference to understand that stroke can be serious, but you can beat it as well. Now, spotting the warning signs and early symptoms of a stroke is key to reducing the risk of permanent disability or death when stroke strikes. In the previous sessions, we have heard from senior doctors who have nicely explained to us the symptoms of stroke and even how to prevent it. A quick and easy way to remember the most common signs of stroke is with the acronym BFAST. It stands for balance loss, eye disturbances, face drooping, arm weakness, speech difficulty, and when this happens, it's time to rush to the stroke-ready hospital immediately. So that is the acronym for stroke, BFAST. Now, we have with us doctors and the patients who have survived stroke and their experience during the days and the minutes leading up to the stroke. So I'm very happy to see that we have with us Dr. Arvind Sharma, who is joining us now. And we will be joined by, we are joined by the other doctors as well. But let me start with you, Dr. Arvind Sharma. He's the head of Department of Neurology and Stroke Specialist at Zydus Hospital, Ahmedabad. He's been an active member of the Indian Academy of Neurology, Indian Stroke Association, and the Neurological Society of India, the World Stroke Organization, the European Stroke Organization, and the Indian Stroke Organization. He's also the founding member of the Society of Neurosomnology. Thank you so much, Dr. Sharma, for joining us. We have a video of one of your patients. But before we come to that, tell us about this patient of yours, and in what state did he come to you, and what were the steps that you took?
Can you see me? That's what I was just trying. Okay, I'll reconnect.
Okay, I'll request the other speakers to please put themselves on mute. Yes, please go ahead, Dr. Sharma.
Yeah, thank you, Anisha, for the introduction, kind introduction. And I can see the plethora of stroke neurologists and a wonderful first session by Dr. Padma, Dr. Sudhir, and Dr. Satish. Thank you for making the ball rolling and in a wonderful way. So we're now talking about the stroke survivors. And that is very important to learn that how they present to us is important and how we treat them is important. But the most important that how they take it, stroke, as their disability, or they take it as a challenge. That is very important. So we are talking about one of these stroke survivors. I call him as a stroke champion. Those who take this as a challenge and they are independent and doing their work now. We do a lot of such cases. We have failures also. But one thing that we do our part, God do his own part, but the patient himself does his part, then all the stories are something very good. So if we talk about one of our patient, Prakash Ji Soni, जो कि एक कलाकार हैं, जो कि एक चित्रकार हैं, बहुत ही अच्छे चित्रकार पहले थे और अभी भी हैं. तो वो जब स्ट्रोक से सफर किए, उनको इश्केमिक स्ट्रोक हुआ था और वो पोस्टीरियर सर्कुलेशन स्ट्रोक था, जहां पीछे की तरफ उनकी नली बंद हो गई थी. Anisha, it was told to me that I should be speaking in Hindi. Is okay? It's really okay?
Yes, Mr. Sharma, you can go ahead.
Yeah. So the story was he came from one of the place near to Gujarat. We are in Ahmedabad. He came from Sanchor. So he came with the paralysis. He came with the giddiness, imbalance, and paralysis of one side, and that was right hand and right leg. वो उसी हाथ से चित्रकारी करता था, painter. He used to paint with that. So when we treated him, the challenge was not the treatment. We treated him. But the now सबसे ज़्यादा important चीज़ थी कि वो उस हाथ और पैर से वापस काम कर पाएगा कि नहीं. Specifically, वो चित्रकारी वापस कर पाएगा कि नहीं. तो ये challenge लेके वो गए और उन्होंने अच्छी फिजियोथेरेपी करी और उसके बाद जब वो आए एक बार फॉलोअप पे, तो मैं आपको बताना चाहूँगा, he asked me for a passport size photograph. He has not told anything to me कि वो क्या करने वाला. He continued that physiotherapy for 3 months and he came with a beautiful portrait of mine, which was so heartwarming and so touching. And if you can play that picture at present, it will be great. I think we have given the pictures to you. It will be wonderful if you can share that on the screen. See, this is what he brought with his paralytic hand. This is what, there the Prakash Bhai, his video will be there. This is what he made after he recovered from the. So these are the stories which makes us more and more enthusiastic to treat these stroke patients in time. So I'll tell you that how it is important to come in time. That golden window of 4.5 hours to treat for acute stroke is important, and you can make a difference. But stroke is not a magic bullet. You have given a clotbuster drug at the time. That is not a magic bullet cardiac that you open up the artery. It is after 3 months, how much the activity of daily living वो पेशेंट कर सकता है या वो स्ट्रोक सर्वाइवर कर सकता है. तो उसमें केवल हमारा ही हाथ नहीं है, भगवान का भी हाथ नहीं है, वो प्रकाश सोनी जैसे पेशेंट का भी हाथ है. देखिए वो क्या कर गया. एंड नाउ ही इज मेकिंग पिक्चर्स ऑफ प्राइम मिनिस्टर नरेंद्र मोदी. ही इज मेकिंग हमारे प्रधान के, ही इज मेकिंग pictures for many people, and he's working like anything. So these are the stories which makes us happy, which makes us more and more enthusiastic to treat such stroke survivors, stroke champions, rather than calling them as a patient.
बिल्कुल ठीक कहा आपने डॉक्टर शर्मा. जब हम ऐसे पेशेंट्स की कहानियां सुनते हैं, जब हम उनको देखते हैं तो सब इंस्पायर होते हैं. और जब पेशेंट्स की दृढ़ शक्ति सबको दिखती है तो सबका डर भी किसी हद तक थोड़ा कम हो जाता है. अब मैं रिक्वेस्ट करूंगी हिमानी को कि वो वीडियो प्ले करें टू शो एवरीबडी हाउ दिस आर्टिस्ट ओवरकेम द इफेक्ट ऑफ अ स्ट्रोक and now is doing wonderful portraits as if it was just normal. It is his own determination and his own dedication to get better that has served him well.
Just Tanisha, I want to add, he was not able to move his arm and leg a bit जब आया था तब. और अब देखिए.
Okay.
मैं चित्रकार प्रकाश सोनी. मुझे मार्च 2017 में घर बैठे बैठे चक्कर आया. वह मेरे घर वाले सीधे गाड़ी में जायडस हॉस्पिटल अहमदाबाद लेकर गए. मुझे कुछ भी मालूम नहीं था. मेरे को ब्रेन हेमरेज हो गया था. मेरा इलाज डॉक्टर अरविंद शर्मा जी ने किया. मैं आज बिल्कुल स्वस्थ हूँ. मैं आज भी पहले से अच्छा कार्य कर रहा हूँ. मैंने प्रधानमंत्री जी नरेंद्र मोदी जी को भी मेरे हाथ से बनाई कैनवास पेंटिंग भेंट की है. मैंने सबसे पहले मेरे इलाज करने वाले जायडस हॉस्पिटल के माने हुए डॉक्टर अरविंद शर्मा जी की पेंटिंग बनाई. उनको भी मैंने भेंट किया. मेरा इलाज करने के बाद में मैं पहले से भी अच्छा कार्य कर रहा हूँ. मैंने भारत की कई बड़ी बड़ी हस्तियों की पेंटिंगें बनाकर मैं भेंट कर चुका हूँ. मैंने राजस्थान सरकार से कई बड़े बड़े नेशनल इंटरनेशनल पुरस्कार भी प्राप्त किए हैं. मैं आज बिल्कुल पहले से भी अच्छा महसूस करता हूँ. ये सारा काम मैंने सही होने के बाद में किया है. आज मैं बिल्कुल स्वस्थ हूँ. मुझे भी कोई तकलीफ नहीं है. मैं खाली 2-3 टैबलेट लेता हूँ. हॉस्पिटल से मैं जब इलाज के बाद घर आया तो डॉक्टर साहब के कहने के मुताबिक मैंने सुबह शाम कसरत पे ज़्यादा ध्यान दिया. मेरे घर वालों ने भी मेरी बहुत ज़्यादा हेल्प की. आज मैं बिल्कुल मस्त हूँ, स्वस्थ हूँ. थैंक यू डॉक्टर अरविंद शर्मा जी का.
So this is what he has done after the physiotherapy, which we make very important for the patient, because if they get the thrombolysis, that is, he had a ischemic stroke. He told hemorrhage. I'm sorry for that. He had a ischemic stroke, and this is what they do after the physiotherapy. And this is what, if you reach on time and get the stroke treatment, matters, and how he's able to do his work. नहीं तो आप जो काम करते हैं, and you are the bread earner, and he was at the age of 52 at that time. It makes a hell of a difference. The time is brain. Time lost is brain lost.
Definitely. You said it, Dr. Sharma, time lost is brain lost. And we are very happy to have Dr. Hastak with us, Dr. Shirish M. Hastak. He is Regional Director of Neurology, Global Hospital in Mumbai. He has 27 years of experience in stroke management. Dr. Hastak is among the top stroke specialists in India. He is highly experienced neurologist in the management of hyperacute stroke patients and the use of bridging therapy in combination with thrombolysis for helping patients with acute strokes. Thank you so much, Dr. Hastak, for joining us. And your patient, Ms. Geeta Bansali, is also with us. But let me start with you, Dr. Hastak. Tell us, you must be seeing so many patients who come to you with a stroke. What was the case of Geeta Hastak, and how did she present herself?
Yeah, thank you. Thank you for those kind words, and hello, friends. Today is the World Stroke Day, and today we want to create awareness about stroke, so that we can help save hands, legs of people. And I think Geeta's story is a fantastic story, and you must hear it from Geeta. But I will just tell you what happened. So one, fine April morning a year ago, last year, April, I went to the hospital, and I was told that there is a patient in the emergency, so please rush. Please rush. Hi. Yeah. So I was told, please rush. And I rushed to the hospital, and I rushed to the emergency immediately. And in the emergency was this lady, and who was having a severe headache. I mean, it was the worst headache of her life. She was in agony. And interestingly, I went and saw her, and she asked me a question, which really was interesting. She said, in all this agony and in headache, she said, Doc, will I be able to play squash? And I still remember that, in 27, 28 years of my practice, a patient in that much agony asking me such a question, I was taken aback. But then I thought for a second, who am I to, take away hope from a patient? So, boldly, I said yes to Geeta. And thank you, Geeta, for proving me right. She had a subarachnoid hemorrhage. She had a bleed in the coverings of her brain. And but at the same time, she was conscious, and she heard me. And you could see her face, even in that agony, change. And, that hope came into her eyes. And, I could see that I have created some hope in her, and which gave me satisfaction. And, from that, she has proved me right. It's the strength of herself, her inner strength, her spiritual strength, and the strength of her family. And especially, I would say, Bimal, her husband. He's been he's so strong that he would, he would come and ask us questions, but he always said, do your best, Doc. And his support to us, which is now not, the patients question us and, do not support us at times, but his support to us, I'm very happy with patients questioning. But I think his support was something which was terrific. He supported her, Bimal, he supported us, and he let us do all the treatment that we wish to do. And I think Geeta is a living example of how good you can do if you have the support, your own self-support, your spiritual strength, and your inner strength, and your family strength. And I think I salute her for that. I salute her for being, and she has taught me so much in my life as well. So, it's not, it's like, the way she has, dealt with speech difficulty, a left hand leg weak, subarachnoid, coiling, and, all the 10 days in the ICU. And she has written a beautiful book. I just wanted to show it to you all. She's written a beautiful book with poems and everything in it. And so with Geeta's permission, I have stolen a small poem from her book to read to you all as to how life is important. So she says, and this is a poem. The light entered through the tiniest teeny weeny hole. It was called cerebral aneurysm because she bled in the aneurysm in her brain. And she said, it was called cerebral aneurysm. I didn't know the name. I experienced only the light. I don't know where this light has taken me, where it will take me. I am, all that I'm doing is being guided by this light. So I think, she has created something totally different. She is a champion of stroke. And I think that, please everyone, read this book. It will change your life. It is called A Ship That Sails. And thank you, Geeta, for so much of love and affection. And of course, for the society, for lighting a candle for the society. And the candle is of hope. So I think Geeta should take over from here. Thank you.
Thank you, Dr. Hastak. And this means a lot to me. Actually, I have tears in my eyes. Whenever I'm asked to speak about my aneurysm, it's like a gift box, magic box that opens up, and there are too many stories to tell. And yes, I'm going to limit myself to 10 minutes. So yes, I went through something called brain hemorrhage, cerebral aneurysm. But I call, and I was 10 days in the ICU, but I call this most beautiful journey of my life. The 10 days of spiritual vipassana is what I call it. So yes, we are talking about awareness, and when it happened in less than 30 seconds, and I did go through a very minute seizure attack at home. The thing is, my daughter was there, my son was there, luckily, and she did tell me that, "Mom, do you want a crocin?" I said, "No, this is something different." There was a blast in my brain. I did feel something like a blood flow. I sensed it, the blood flow in my brain. And luckily, my husband had just left. So the fact is, going to the hospital, a timely treatment is so crucial. I was rushed. In less than 20 minutes, I was in the hospital, and life changed. It was like magic started happening in my life. So when I magic, I can't even describe it in words. At one point, when I was in the ICU, there was immense pain, too much pain, unbearable pain, and there were so many machines. I technically knew that something has happened. I knew it. But there was another bigger part of me which was experiencing something very, very different, something very magical. It's like how you do a deep sea diving, how you do a bungee jumping, or how you do a skydive. It's like that fear initially, and then that fear just vanishes, and they're in a magic land. I was experiencing that kind of a magic. I don't know how to describe this in words, which is why I've written this book, which is a ship that sails. It's like everything drops. It's like the old dies and something new emerges. It's like facing the absolute fear, absolute death. I don't even know what was happening. I didn't imagine that I'd fallen sick. I knew I was sick, and I didn't know I was sick. I was living in this amazing, beautiful world. And, technically, I don't like doctors. I don't like hospitals. I don't like ICUs. After this, I've fallen in love with the medical field. I've started studying the brain. I've started understanding how the brain works. My life has actually turned around. So in this 10 days, I've understood the meaning of love. And again, as Dr. Hastak read, and I would like to read one poem, which is about love, which is written in my book. I'm going to read that poem. I thought I knew love until someone shed a tear, someone held my hand, someone fought for me, someone prayed for me, and actually got angry with God. Someone wore a beautiful dress for me. That was my daughter. Someone had a morning cup of tea with me. That was my husband. Someone made me hear a mommy song, which was my son. Someone painted for me. Someone irritated me until I laughed. Someone pressed my leg. Someone dressed me like a queen, which were the nurses. I wouldn't have known love if this didn't happen. So I experienced a lot of immense love. Actually, I was in this magic dream state. I became like a child. I was born again. So I came back with a lot of, I couldn't walk, I couldn't eat, I couldn't sit. There were too many things that I couldn't do. But it was the love and care of my family and the support of my husband, which made me become absolutely fine. Today, I can say I'm absolutely fine. So I would like to sum up as to the cause. Yes, initially the doctors were talking about blood pressure and all these things, which are the causes of hemorrhage. my cause was suppressed anger. For so many years, I'd suppressed my anger, which became a blast, and it came out as an aneurysm. So it's very important to become aware of what is it that you're suppressing. The causes could be immense. My cause was anger. So suppressed anger can cause hemorrhage. So one is about the cause, and then is about the recovery. So absolute timely treatment is mandatory. So that is one thing. Having a doctor like Dr. Shirish Hastak and Dr. Rashmi Saraf. I mean, yes, multiple doctors, but about hemorrhage or about stroke is I became like a child, where a child only needs love, trust, and gentleness. And my doctors gave me that kind of love, trust, and gentleness. I could totally surrender to Dr. Hastak. Like, I used to wait, when will Dr. Hastak come? 10:30, used to come at around 10:30 at 11 in the morning. And I used to desperately wait. And the minute he used to leave, he would pat on my hand and he would say, okay, she's doing fine. And that it was like a victory for me, as if I've achieved a gold medal. I don't know what it is. Like, just how a child is. Now, a child can sense the gentleness, love, and trust. And that's the kind of surrounding or the atmosphere and the kind of doctors that a stroke patient needs. And that I was lucky enough to have these kind of doctors and the nurses and the care. Then the other thing is, we need enough time to heal. Don't be in a rush to get back. I allowed myself absolute enough time. I didn't meet anybody for 3 months, not even my own parents, because I needed that much time to heal. So that is very important, having enough time to heal from within. Listen to yourself, listen to your body, listen to your emotions, listen to your thoughts. I used to journal a lot. I used to draw a lot. I didn't rush into doing something. And so that is very important, listening to yourself, and then breathing. I couldn't even breathe properly. So my daughter used to tell me, Mama, even one breath is enough. So I used to take a lot of effort, did a lot of yoga to breathe. Breathing is very, very essential. Then obviously having full faith. Nothing can happen without faith. And of course, as Dr. Shirish said, my husband, I mean, he is commendable. He's like the pillar of strength. So his faith, the faith that my family had in me, that got me alive. The faith that my doctors had in me, that got me alive. So even when I'm eating the medicine, I would have faith in the medicine. I said, okay, this is going to cure me. So having that kind of faith, and faith can actually turn around everything, and my world turn around. And actually now I call my aneurysm Annie. And I have a conversation with Annie, like, Annie, are you okay? And my Annie guides me. Annie, can I do this? Annie, can I play badminton? Annie, can I do this? And Annie will tell me, no, it's better you sleep. And then I will sleep. So I've drawn pictures of Annie. So it's very funny, but I can actually feel my Annie. I can have conversation, and now it's like my best friend. Mm-hmm. I would like to set it up is, I went with a scar in my brain, and I came back with multiple hearts. I don't think, I'm not saying that stroke is good, but we can look at stroke as a gift, because any illness for that matter brings to us some gift in some form or the other. Change our perspective and have that outlook towards an illness or towards stroke for that matter. Not only the family, the whole world changes. It's beautiful how, I mean, I can't even imagine how much I've gained from my aneurysm. So thank you so much, Dr. Hastak, and thank you to the whole Walker team. Thank you to my family. Thank you to the universe. I can't even, actually my heart overflows with gratitude. I don't know what to do with so much gratitude. And which is why I've been talking to Dr. Hastak, that I really want to kind of create a support system or do something about writing about stroke, or creating certain programs, or working with some neurologists. I don't know. Currently, starting to study the brain. So, and I'm totally loving it. I would enroll in some a neurologist course or something, and then have a formal education.
Right.
But I know I've so much, but thank you is not enough. So thank you.
Thank you so much, Geeta, for talking about your journey. It's truly inspiration. And I'm going to try and buy that book, The Ship That Sails. It certainly is going to be very inspiring. And thank you so much for being with us. Now we have Dr. Pradyumna J. Oak, Director and Head Neurology, Nanavati Super Speciality Hospital, Mumbai, also joining us. The Director and HOD at the Department of Interventional Neurology in Nanavati Hospital, the Prince Ali Khan Hospital, Sethi Hospital, and Shushastra Hospital. Dr. Pradyumna J. Oak has several years of rich professional experience in his field. He has treated several patients suffering from neurological diseases in India and gives patients the best of medical care. Welcome to the show, Dr. Oak. You have a patient, Mr. Gaikwad, who you treated, and we are looking forward to hearing his story. But for you treat so many stroke patients, so what is it that you would like to tell everybody watching? Speed is of essence. What is the other thing that is also important?
So thank you very much for involving me in today's program. So today is World Stroke Day, and stroke is the second major killer. What is happening right now is that only very few patients, up to 2 to 3% of the patients, are coming in the golden hour to the hospital, to the stroke ready hospital. So it's very important for patients to understand the symptoms of stroke, and they should come to the stroke ready hospital as fast as possible so that we can reverse the neurodeficit by treating them correctly. Going to a nursing home or their general practitioners or family doctors will get them diagnosed correctly, but they may not be able to get correct treatment. So for right treatment of the stroke, a patient has to come to a stroke ready hospital. So we have this patient, Rohit, whose story we will share. I have a video when he came to us now. This is during the COVID pandemic, we treated him. He lost his father during COVID pandemic, and then he stopped taking his medicines. He has undergone a surgery for the carotid artery about 2 years back. And during the COVID pandemic, he stopped taking the medicines. And after loss of his father, he was alone, feeling lonely, and he started drinking excessive alcohol as well as smoking. And then he landed up in our casualty early in the morning with stroke. His left side was completely paralyzed. Can we run the video? We have his video when he came to the casualty.
हाथ उचल वरती हाथ उचल उजवा हाथ उचल डावा हात उचल डावा पाय उचल वरती इकडे माझ्याकडे बघ इकडे माझ्याकडे इकडे ओके
This has a gaze palsy. He was not able to see anything on the left side, and his left side was completely paralyzed. So he has a major occlusion. He has a complete occlusion of one of the carotid arteries in his brain, and we did his MR, and we took him immediately in the cath lab, and we stuck the clot from his carotid artery, which was right up to the middle cerebral artery, which is the major artery of the inside of the brain, and we stuck the clot out, and then we put 2 stents in his carotid artery because his carotid artery was diseased. And on day 2, we have another video of his. On day 2, after the procedure, he started showing improvement. Can we run the second video? Arm and leg. And before discharge, can we run the next video, please? And now he is sitting by my side. He is working in Bajaj Finance, and he is back to his work completely normal. He has promised me that he will not smoke anymore, and he has stopped drinking alcohol completely. So if a patient comes in time, we can change the life of the patient. We can really help, and it's very satisfying when we see such results in patients. Otherwise, he would have been disabled for the rest of his life, and he would have never been able to go back to his work. So it's very important to reach to a correct hospital and get right treatment. So Rohit is here with me.
Right, Dr. Oak, just one question. What was the total time of his treatment at your hospital?
So our door, when a patient comes to us an acute stroke, we call it as a door to needle time or door to puncture time. So we have a code white in our hospital. So once a patient of suspected stroke comes to us, we activate that code white, and it gives an automated call to 34 people in the department, including our radiology department, casualty, including our neurointensive care, stroke neurologist, that's me, our cath lab, and the security. So we create a green corridor so that the patient is transported from the casualty to the scanner, and from the scanner to the CCU, that is neuro ICU or cath lab, in 5 minutes time. So our door to needle time is close to 35 minutes, and our door to puncture time is less than 1 hour. So he received treatment within 40 minutes after arrival to the hospital, and we opened his artery in 30 minutes flat after taking him into the cath lab, and the results are absolutely beautiful. He is back to normal.
All right. Mr. Gaikwad, मैं आपसे पूछना चाहूंगी, जब आप हॉस्पिटल आए तो आपके मन में क्या चल रहा था? हमने आपका वीडियो देखा, आप अपना लेफ्ट हैंड, लेफ्ट लेग हिला नहीं पा रहे थे. जब आप हॉस्पिटल गए, आपको पता था क्या हो रहा है, और आपने सोचा कि अब इसके बाद मैं क्या कर पाऊंगा? क्या आपने सोचा इस तरह?
एक्चुअली जब मैं लाया गया था तभी मेरे को कॉन्शियस नहीं था मैं टोटली.
अच्छा.
उस तरह से मुझे याद नहीं था कि एग्जैक्टली क्या हो रहा है. लेकिन जिस दिन मैं होश में आया सर्जरी के बाद, उस दिन से मेरा सब कुछ ठीक चल रहा है, क्योंकि घर में मैं जब सो के उठा था तभी मैं गिर चुका था, मैं खड़ा ही नहीं हो पा रहा था. वैसे मुझे हॉस्पिटल लाया गया, MRI करके हॉस्पिटल लाया गया नानावटी में. फिर सर ने ट्रीटमेंट शुरू कर दिया. फिर नेक्स्ट डे जब मैं होश में आया तभी मूवमेंट सब शुरू हो चुका था.
ठीक है. आपको कुछ दर्द हुआ? कुछ जैसे गीता मैम ने बताया कि बहुत सर में दर्द था तो वो हॉस्पिटल गई. आपको कुछ दर्द था? कुछ पता था कि क्या हो रहा है?
मैं नींद में से उठा और उठ के खड़ा होने की कोशिश कर रहा था, मैं गिर.
अच्छा. जब आप हॉस्पिटल में आपकी ट्रीटमेंट चल रही थी तो आपके मन में क्या सवाल था? आपने डॉक्टर से पूछा कि डॉक्टर मुझे क्या हुआ है, मैं ठीक से सब बिल्कुल ठीक हो जाऊंगा, मेरे हाथ पैर चलेंगे? आपको कभी कुछ डर था इस तरह का?
मुझे कुछ याद ही नहीं था. जिस दिन मैं होश में आया उस दिन मैंने सर से बात किया कि क्या हुआ था क्या नहीं हुआ था. ये सर ने सब कुछ बताया. उस तरीके से मैंने पूरी तरीके से स्मोकिंग छोड़ दी है.
और मतलब जब आप हॉस्पिटल छोड़ के गए उसके बाद से फिर जो फॉलो अप ट्रीटमेंट है, फिजियोथेरेपी या जो एक्सरसाइज और लाइफस्टाइल चेंजेस है, वो सब आपने किए हैं क्या? डॉक्टर ने आपको एडवाइस किया था?
सर ने जितना जो एडवाइस किया वो सब मैंने फॉलो किया. इस वजह से आज मैं पूरी तरह से ऑफिस वगैरह कर रहा हूँ. मेरा जो भी जॉब प्रोफाइल है से बहुत अच्छी तरीके से कर पा रहा हूँ.
गायकवाड़ जी, जो लोग ये देख रहे हैं प्रोग्राम, आप उनको क्या संदेश देना चाहेंगे? जैसे बहुत सारे लोगों को पता ही नहीं है स्ट्रोक क्या होता है, शायद आपको भी समझ नहीं आया होगा कि उठते ही आप गिर क्यों गए. तो आप क्या बोलना चाहेंगे सबको जो ये प्रोग्राम देख रहे हैं कि कैसे कोई सतर्क रह सकता है?
सबसे पहली बात तो ड्रिंकिंग, स्मोकिंग और टेंशन, इसके वजह से आदमी अपने आप को ही ज्यादा कोसने लग जाता है. और अल्कोहल की वजह से जब आदमी को तकलीफ होती है वो समझ में नहीं आती. जब अल्कोहल उतर जाता है उसके बाद आदमी को मालूम पड़ता है कि क्या हुआ क्या नहीं हुआ, तो तकलीफ बढ़ जाती है बहुत. और इसका इफेक्ट अपने फैमिली मेंबर्स पे बहुत ज्यादा हो जाता है. क्योंकि अगर राइट टाइम पे ट्रीटमेंट नहीं मिली और आदमी फाइनली डिसेबल हो गया तो फिर फ्यूचर लाइफ कुछ भी नहीं बचता. तो उस हिसाब से मतलब डॉक्टर जो कुछ कह रहे हैं उसे फॉलो अप करना बहुत जरूरी है.
All right. Gaikwad ji, Dr. Roke, Geeta, Dr. Hastak, thank you so much for joining us today and telling us about your stories. It's truly inspirational when we see patients having made a full recovery. It seems that it is possible to overcome this deadly disease, and the fact that you need self-belief, you need discipline, and these patients have shown us that by following that, they've made a complete recovery. And the sky is not the limit for what they can achieve now that they're back to another life. Thank you so much for joining us today and sharing with us your experiences.
Thank you.
So what we have seen here, heard from the doctors and the patients, is that the first few hours are super critical for the kind of recovery you make once you get stroke. So in this session, we will be discussing the golden hour and the frontline healthcare ecosystem. Now, time saved is brain saved, and the very same time lost is brain loss. That is why recognizing the signs of stroke is very important. Immediately knowing what to do when someone is having a stroke can, excuse me, can save someone's life and help them avoid permanent disability. Now, we will be joined by a panel of experts who will talk us about the importance of the golden hour for stroke patients. So please welcome our experts who are joining us now. And we are very happy to have with us Dr. D.S. Gupta, Senior Consultant and Stroke Unit Head, District Hospital, Jhansi. Welcome to the show. And we have with us Dr. Professor Pushpendra Nath Ranjan. He is Senior Consultant Neurologist, Stroke and Academic Advisor, Institute of Neurosciences, Indraprastha Apollo Hospitals, New Delhi. And we have with us Dr. Arun Garg, Director, Institute of Neurosciences, Medanta, the Medicity, Gurugram, also joining us on this session. So I'm guessing we will be joined very soon with the rest of our panelists. We're very happy to have you, Dr. Ranjan, with us. Thank you so much for being with us. Let me ask you the first question then. What is this golden hour in stroke, and why is it so important to reach the nearby stroke-ready hospital as soon as possible? Dr. Ranjan, I would request you to please unmute yourself so that we can hear you. Sir, you're muted. Can you unmute yourself? We still can't hear you, Dr. Ranjan. All right, I think Dr. Ranjan is going to get some help so that he can unmute himself and we can hear why the golden hour is absolutely critical. In fact, we've heard patients also tell us that it was, it was critical that they reached in time, and they were grateful to their doctors that they got timely treatment, and that is what saved them. So, Dr. Ranjan, I think we can hear you now.
Yeah. Good morning, everybody, and thank you very much, Ishita. It's nice to be here, and you asked me a very, very relevant question, because what has been watching till now has been very relevant. That the word time is brain, and treatment delayed is treatment denied. So what is this concept like time is brain? What does it mean? It only signifies and makes it wider that the stroke is an emergency. As rightly has been pointed out, you have two varieties of stroke. One is an ischemic stroke because of a clot. One is an hemorrhagic stroke because of a bursting in the arteries. So if you have a ischemic stroke or hemorrhagic stroke, you need to take medical advice. Now, what is this golden hour period? The golden hour period was 3 hours. Now we extended it to 4.5 hours. So if you have a stroke, minor, major, intermittent, you should immediately go to the hospital. We do a CT scan, and if the CT scan doesn't show any evidence of a hemorrhage, then we have a drug which is called a clot busting agent, which is called tissue plasmogen activator, which can be given from 3 to 4.5 hours to dissolve the clot. So that is what we mean by a golden period. To go early to the hospital, get this drug, and then do an angiography and see whether you have any obstruction in the artery, and you could do a thrombectomy and take out. So when we say that, now let me tell you more than that. Beyond the golden hour, beyond 4.5 hours, even if you've gone beyond 4.5 hours, even if it's 6 hours, 9 hours, please go to a hospital which gives you the state-of-art stroke services. We have newer studies, newer methods to improve your stroke and improve your quality of life. So that is why we all stress the golden period. And time is brain. Please don't wait. Don't wait for the stroke to increase.
Right. Dr. Garg is also with us. Dr. Garg, Dr. Ranjan has underlined for us that, जल्दी जाने से तो बिल्कुल आप ट्रीट बहुत अच्छी तरह से हो जाएंगे, पर सब स्ट्रोक रेडी हॉस्पिटल के पास नहीं रहते. काफी लोग, बहुत सारे लोग तो मैं कहूँगी जानते भी नहीं है कि वो सिम्टम्स पहचान पाए कि चलो हमें स्ट्रोक हो गया है. तो इन लोगों का क्या होगा फिर? अगर कोई देर से हॉस्पिटल पहुंच रहा है तो क्या ट्रीटमेंट ऑप्शंस हैं और उनका क्या फिर आउटकम होता है, क्या प्रोग्नोसिस होता है? डॉक्टर गर्ग, मैं आपसे रिक्वेस्ट करूं कि आप अनम्यूट कर लीजिए अपने आप को.
तो जैसा डॉक्टर रंजन ने बताया कि 4.5 hours इज द विंडो पीरियड जिसमें कि पेशेंट कैन रिसीव थ्रोम्बोलिटिक ट्रीटमेंट. लेकिन ऐसा भी होता है कि कुछ पेशेंट्स दे कैन नॉट रीच विद इन टाइम फ्रेम एंड वी आर स्टार्टेड डूइंग मैकेनिकल थ्रोम्बेक्टमी व्हिच द विंडो पीरियड फॉर व्हिच इज अप टू 24 hours. एक और जो इशू है व्हिच इज very strong negative point in our country is we don't have any emergency medical service. जब emergency medical service की जब अनअवेलेबिलिटी हमारी कंट्री के अंदर किसी भी एरिया, रिमोट एरिया में बैठे हुए किसी पेशेंट को स्ट्रोक होता है तो बहुत ही कम लोग होते हैं जो कि विद इन विंडो पीरियड हॉस्पिटल पहुंच पाए. इस सिचुएशन में वी हैव स्टार्टेड डेवलपिंग अ प्रोग्राम व्हिच वी कॉल्ड ब्रेन रेस्क्यू प्रोग्राम वेयर वी क्रिएटेड अ 3-tier system, spoke and hub model, where there is a central comprehensive center which is Medanta Medicity, which is connected through secondary centers, and then the secondary centers are connected to primary centers. Primary centers होते हैं जहाँ पे कि आपके नियर बाई कोई क्लिनिक है, वहाँ पे पेशेंट पहुंचा, उसने सिम्टम को आइडेंटिफाई किया, they will send such patients to secondary centers. Secondary centers are basic centers where the facility for CT scan is available. They have basic ICU and an internist or a critical care specialist doctor is there who can treat situations with thrombolytic therapy. And in case of mechanical thrombectomy is required, then such patients are referred to comprehensive centers. Suppose patient cannot reach within 24 hours to the hospital, in such a situation, one should not get disheartened. उसको ऐसा नहीं होना चाहिए कि अब लाइफ मेरी खत्म हो गई, मैं कुछ नहीं कर पाऊंगा. Still we have other options. हमारे लिए जरूरी होता है कि एक तो सबसे पहले स्ट्रोक की सीवियरिटी क्या है. यदि सीवियरिटी नहीं है, then physiotherapy. And there are certain other integrative medicine programs we run जहाँ पे कि हम regular physiotherapy करते हैं, massages करते हैं, साथ में भी put patient on certain neuro regenerative agents, and at the same time we have complete comprehensive neuro rehabilitation team which is providing them psychological therapy, psychological support, and at the same time occupational therapy. And such patients do very well if they are well taken care in initial period. There is neuronal plasticity. Brain goes on regenerating, and this plasticity is a continuous process. It is best within 3 months of stroke, but it may continue for a period of 1 year or more than that.
ठीक है, तो ट्रीटमेंट लंबी देरी के लिए चल सकता है, बट आउटकम अच्छे हो सकते हैं अगर आप पहुंच जाए स्ट्रोक रेडी सेंटर, वहाँ ट्रीटमेंट फॉलो करें और जो भी फॉलोअप्स है, चाहे वो फिजियोथेरेपी हो, जो भी हो, उसको आप बरकरार करें और ठीक तरह से करते रहें तो आप ठीक हो सकते हैं. अगर आप देर से भी पहुंचे या आप 5 घंटे से पहले ना भी पहुंच पाए तो ट्रीटमेंट ऑप्शंस हैं. Dr. Gupta, it's quite clear, that from the perspective of stroke treatment, timing is very important. The first few hours is very, very critical. Now, what are the specific measures taken in hospitals itself to ensure that time is not wasted? There's a time for admission, then imaging, and what measures are taken in hospitals themselves so that the patients get absolute timely intervention if they are suspected of having a stroke?
Thank you, madam. Actually, in my hospital, as you know already that, dear friends, and I want to tell all the persons that we have the fundamental right to receive at point of care advanced aid within 4 minutes. But people in need do not always get it, as you know. Jhansi is a clean city of about 10 lakh populations, having only one stroke ready hospital in entire Bundelkhand of Uttar Pradesh and Madhya Pradesh. As you all know, that the frontline ecosystem plays a crucial role in the bringing stroke patients to the hospital and providing the right first aid. Dear friends, however, India's frontline healthcare ecosystem is deeply lacking. Trained manpower, equipment, and facilities is a major challenge. So, we are here to debate how a robust healthcare system can be created to ensure fast response. In my hospital, we have made a fully developed stroke situated. My hospital is situated near the fort of the Rani Jhansi, the first independent fighter, as you all know. Before considering their name as team member for the stroke, I personally discuss and choose the persons and take their consent for devotion. ऐसा नहीं है कि जबरदस्ती सोचा किसी को भी हम टीम में मेंबर रख ले, ऐसा नहीं करते. तो सबसे पहले हम उनसे कंसेंट लेते हैं कि भैया आपको काम करना है डिवोशन के थ्रू, तभी हम उनको टीम मेंबर बनाते हैं. हमने इतनी अच्छी टीम मेंबर बनाई है. एंड आई चूज आल्सो द पर्संस, पैरामेडिक्स, स्टाफ्स एंड फैसिलिटेट देम टाइम टू टाइम. जैसे अपने प्रधानमंत्री ने फैसिलिटेट किया है हमारे मेडिकल्स को, मैन को, ऐसे हम भी अपने टीम मेंबर्स को फैसिलिटेट करते हैं and give them training and demonstrate when needed. We have made WhatsApp group of the stroke team of district hospital, medical, paramedical and concerned team. As you know, I have also joined with WhatsApp group of UP, which is headed by the Dr. M.V. Padma. She was also here in this talk also.
Section, yes.
And we take advice from her also. Nowadays, all of our consultants using telemedicine to provide help to our patients because of the COVID. All patients entering the hospitals are giving for the antigen testing for COVID-19, but any suspected patients of paralysis is tested on priority basis. And our barbed wire are trained and they carry the suspected patients to the CT room. And there also on priority basis, CT scan done. Other tests are also done hand by hand before admission and shifting to the designated stroke ICU. All members of our stroke teams becomes alerted and stroke nurses take consent by the attendants, explaining about side effects like 1.6 to 2% bleeding due to thrombolysis. Stroke team of the district hospitals comprises all EMOs. They are working 24/7. All physicians with ECG technicians, administrator, CMS, our SIC, neurosurgeon call, radiologist with CT technicians, pathologist technicians, LTs, pharmacists, even 3 stroke nurses, physiotherapists, psychiatrists, dietitians also, and hospital manager and data entry operator is also with us, and they enter the rescue data. We are doing a regular training for stroke management along with COVID nowadays. For psychiatrists, is helping patients of residual deficiencies and in COVID also nowadays. So in my team, I have included psychiatrists to help the persons, and for complaints timely turned up within 3 to 4 hours at district hospital Jhansi. So in our city and in our hospital and city clinics also there, they are also helping the patients for prevention, atrial fibrillations if any. As you know, atrial fibrillation can cause the brain stroke also. Our motto is awareness, assess and action in terms of act fast. Dear friends, because of the devotion of my stroke team, I am now able to minimize DNT up to 25 minutes. This is, I think it is best in UP and in many places of our nation. And we help our people to disability-free life. We also arrange school education for stroke awareness, nowadays by webinars involving teachers and students. And here is a stroke survival club also to spread awareness amongst each other and society. We are also telling people about myths of the brain stroke, that it is not only the disease of elderly people. Dear friends, it is curable if a patient reaches within golden hour at the distinguished facility with proper care, medication and devotion in my hospital. So with your help, and this is also a program, today is the 29th day, World Stroke Day. So we are here to discuss and spreading the, I think we are spreading education to the people, and we are connected here. And thanks, madam. And if any question you want to ask or discuss with us.
Definitely. Dr. Ranjan, Dr. Gupta has now outlined for us how at their hospital they have proper SOPs in the pandemic also to ensure that a timely treatment is given. Now, what about family members? How do they recognize the signs of stroke, and how can they be prepared? Plus, it's one thing to have a stroke-ready hospital. I mean, if I feel my family members had a blackout, I may take them to a hospital which may not be stroke-ready. So at such a hospital, don't paramedics have to be trained to recognize as well and then redirect to the right hospital? How does it work for family members and paramedics that may not work in a stroke-ready hospital?
I first mention one thing. That is very rightly you pointed out, that we are a Apollo Interest Hospital, is a stroke-ready hospital. So to cut down that so-called the window period, so that no time is wasted as soon as the patient enters the gate of the Indraprastha Apollo Hospital. As soon as the patient enters, he's in the triage. He sounds the code fast. And code fast is amongst 7-8 people who are involved in acute stroke. As a result of which, within the next 20 minutes, the patient has already had a CT scan, the MRI scan, because our MRI center, our CT center, our stroke ICU are tried, all are in this ground floor in the same place. So that is how we cut down upon the time that the patient's interventions take place. That's number one. Number two, as you very rightly said, the awareness of stroke. The most important thing, and the thing which bothers most of us, is the awareness of stroke, which is very poor. Everybody is bothered about a heart attack. You have a pain anywhere in the chest, you have stroke symptoms, you have arrhythmia, you have weakness, you end up with. To get over this, at least again, in our hospital, we have a stroke awareness group. We have a meeting once in a month. We call all our stroke patients, their caregivers, which is about 250, 300 patients at a time, and told and taught that what symptoms of stroke are. Even if your relative has a stroke, please teach the other people also about the symptoms of stroke, which is helping out to us with a very large extent. With a small study, I won't say a study, I just picked up about 10,000 patients of stroke. And you won't believe me, but you have to believe me, that not more than 20% knew the signs and symptoms of stroke. All of them knew the signs and symptoms of heart attack, but none of these guys knew the signs and symptoms of stroke. As a result of which, we as neurologists, in addition to talking about thrombolytic therapy, thrombectomy, this and that, we have to increase the awareness of stroke in our population, which will help us to decrease the awareness, decrease the incidence, and give us better treatment for our patient, and they'll come in more time to the triage for acute stroke.
All right. Thank you so much, Dr. Ranjan, for taking us through, the SOPs and how it's not just enough for doctors and specialists to talk about the treatments that are possible for stroke patients, the importance of the golden hour. It is also important for patients who've recovered to talk to everybody else and make them aware of what could be the signs and symptoms of a stroke, because the level of awareness about stroke is very low. Dr. Gupta, Dr. Ranjan, Dr. Garg, thank you so much for joining us this afternoon and taking the time out from your busy schedules to talk about stroke. It is certainly very, very important that everybody comes to know about the symptoms of stroke and can take timely action. And this is the reason why we're having this program, so that we can create awareness about the time criticality of the treatment of stroke, as well as the awareness about what are the symptoms of stroke.
Thank you very much.
Thank you, sir. We will now move on to the... Thank you. We will now move on to the last session of our summit today. And here we're going to talk about stroke care, fact and fiction during COVID-19. Now, we've already heard Dr. Gupta talk about the SOPs in his hospital during the times of COVID for stroke patients. But COVID-19 has been around for nearly a year now, but we're still learning more and more about how this virus impacts the body. Now, COVID-19 infection is known to cause acute respiratory distress syndrome and a hyperimmune response called the cytokine storm. Recent accumulated evidence has also shown that COVID-19 infection is an independent risk factor for stroke. This is because of increased risk of blood clot formation in different parts of the body. The novel coronavirus usually attacks the lungs, causing symptoms such as coughing and difficulty in breathing. But doctors are now starting to worry about another organ, and that's the brain. Who is at most risk of a stroke after testing positive for coronavirus? What should patients and doctors be alert for? We will discuss this with senior doctors who are joining us now. Please welcome Dr. P.N. Salja. She is a professor of neurology in charge of comprehensive stroke care program, Sri Chitra Tirunal Institute of Medical Sciences and Technology in Trivandrum. We have Dr. Brigadier Shankar Prasad Gorti, professor and head of Department of Neurology, Bharati Vidyapeeth University, Pune. We have Dr. Praveen Gupta, director and head, Department of Neurology, Fortis Memorial Research Institute, Gurugram. A warm welcome to all three of you for joining us in this afternoon. Let me start with you, Dr. Salja. Can you highlight the importance of early detection and access to treatment of stroke even during the days of COVID-19 pandemic? We've heard Dr. Gupta tell us about the SOPs in his hospital. Could you give us a little more information on how time is managed when there is a pandemic going around? Dr. Shalja, I'll request you to please unmute yourself. We can't hear. Yes, please. Please go ahead.
Yeah, thank you, Anisha, for inviting us for this session, which is very important. And awareness is all that is going to make a big difference during especially during this COVID pandemic. And on this World Stroke Day, this is the best time to improve upon the awareness. So the first point with regard to why it is important to early recognize the stroke symptoms and reach the hospital, I would just tell for any stroke patient, whether it is pandemic or not, the management of stroke doesn't differ. And we need to understand is that stroke is a much more disabling disease, I would say. And if you look at the data available, we know that after a stroke, at least about 20 to 40% of the patients are going to die in the first 1 month, and 30 to 50% of the patients are going to be displaced. So it's a very time-sensitive one, and we need to urgently take the patient to a stroke-ready hospital. So stroke-ready hospital, what we mean is there should be a setting where the neurologist or a infrastructure should be available for at least a CT scan to be done and diagnose whether it is an ischemic stroke or a hemorrhagic stroke, so that you can start the timely treatment of intravenous thrombolysis or mechanical thrombectomy if it is an ischemic stroke depending upon the severity of the stroke. Second most important point I would say is that in this pandemic, there is always a feeling that everybody is scared to reach the hospital because of the fear of getting the infection. And second is people feel that many of the minor strokes or TIA, there is no, many of the time what happens is if you have a minor stroke or a TIA, it may go off many a time. The patients may expect it to be completely improved by after some time. And these are the patients, you know, that if you have a stroke, at least about 15 to 20% of them have our TIA before. And what we mean by TIA is a mini stroke, whereby you have the same symptoms of stroke, but you have an opportunity to treat them so that you can prevent a big stroke. So what the studies have shown overall in India and also from the data from different countries, it has been shown that the minor stroke patients and the mini stroke and the TIA patients tend to remain at home. So that is something we need to avoid, so they tend not go to hospital. Third important point is that we need to understand that even in hospitals who are COVID designated too, there has been guidelines and SOPs in place in most of the hospitals whereby you have got different pathways by which the patients can be managed. So many of the district hospitals and many of the hospitals which are taking care of stroke patients, which has become completely COVID designated, are not going to treat these patients. But many of the medical colleges and the corporate hospitals and all these academic teaching institutes are treating patients with a stroke, irrespective of whether they have a COVID or not. The reason is we have got a lot of asymptomatic patients coming in with stroke, and you may diagnose that the patient is COVID positive only after the patient is admitted and you have to start the treatment. So you do not decide on the treatment depending upon whether the patient is COVID positive or not. It's all timely treatment. You start the treatment, the pathway doesn't change whether it is a patient is in a COVID time or the patient has got even a symptom to such as COVID. The treatment is going to be the same unless in patients with a patient who has developed a stroke in hospital in a patient with a severe COVID scenario where the situation is going to be totally different, and Dr. Gothi will be discussing further on stroke with regard to COVID. So otherwise, and even the Indian Stroke Association has brought out the Indian guideline of how to manage stroke in the time of a pandemic and how we should have separate pathways of treating these patients, because currently, as has been told by the previous speaker too, we have got telestroke by which even the physicians and the physician model of stroke care is already there in India, and through the telestroke, we can definitely manage these patients.
डॉक्टर कोर्ती, डॉक्टर शैलजा ने हमें समझाया है कि चाहे कोविड हो, आपको ट्रीटमेंट अगर आपको स्ट्रोक है तो जरूर मिलेगी. कोविड की वजह से आपकी ट्रीटमेंट में देरी नहीं होगी. हम आपसे ये समझना चाहते हैं कि कुछ ऐसे रिपोर्ट्स पढ़ने को आ रही हैं कि कुछ रिलेशन है कोविड और स्ट्रोक के बीच में, और जो डेटा दिखा रहा है कि यंगर पॉपुलेशन में भी अब स्ट्रोक हो रहा है. इसके बारे में आप क्या कहना चाहेंगे?
See, first in New York and then in Wuhan, when the studies have come up, they showed stroke is happening in younger people also, and what blood clot that is blocking the blood vessel is happening in the large blood vessels, and that's how it has come. We have seen about 75 cases of stroke from March to September, and when we compared this stroke with the pre-pandemic era of October, November, December, and certainly there is a large vessel blockage in these young patients. So there is no doubt that stroke is happening. Now our country, 60 years and above are only 10 crores out of 130. That means we are a younger country. Whatever strokes happen here will happen in younger people only, and to that extent it is not a big happening that's happening. But yes, stroke is happening, and the mechanism of stroke in young people and old people more predisposed when they have diabetes and hypertension and other renal problems. So whenever these things are there, the occurrence is more. And one more thing is, these people, if they are treated properly, there is no atherosclerosis here. The only block is because of a blood clot that is probably originating from heart because of the viral pathogenesis, viral action on the endothelium or anything. That thrombus is blocking. So if we give treatment within the stipulated time, as Dr. Saleja was telling, within 4.5 hours intravenously, or up to 24 hours, you can remove the clot with mechanical thrombectomy. The stroke recovery will be very, very satisfying in these patients. So there is no doubt that stroke happens in post-COVID patients also. So we are seeing in COVID situation, when the disease is very severe, that's one time we are seeing strokes. And post-COVID, after 3 to 4 weeks, also the strokes are coming now. So that is what we are afraid now, that we may see more number of cases in the survivors of this pandemic for COVID. So these are happening because the blood clotting mechanism is disturbed here, and there are more occurrences of clots in the heart and in blood vessels, which are disrupting the blood supply to the brain, depriving brain of oxygen and glucose, which are the necessary nutrients for the brain neurons to work and express ourselves. So that's what is happening.
Right. Dr. Gupta, डॉक्टर शैलजा ने हमें बताया कि अगर कोविड भी है तो ट्रीटमेंट में कोई देरी नहीं होगी. डॉक्टर गोरती कह रहे हैं कि क्योंकि हमारी पॉपुलेशन इतनी यंग है, इसीलिए ज्यादा हम यंग पेशेंट्स देख रहे हैं स्ट्रोक के साथ प्रेजेंट करें, और ये लार्ज वेसल स्ट्रोक्स हैं. अब मैं ये जानना चाहती हूँ कि अगर मैं ऑलरेडी, मेरे पास कोविड है और मैं किसी कोविड हॉस्पिटल में हूँ और फिर वहां स्ट्रोक हो रहा है, तो फिर ये कैसे मैनेज होता है?
ये बहुत रेलेवेंट सवाल है आपने जो पूछा है मैम, बिकॉज कोविड पेशेंट्स का जो रिस्क है स्ट्रोक का वो बहुत ज्यादा है, जैसे हम ऑलरेडी डिस्कस कर चुके हैं, ड्यूरिंग कोविड और कोविड से ठीक होने के बाद भी, बिकॉज ऑफ क्लॉटिंग मैकेनिज्म्स. और हमारे पास ऐसे केसेस भी आए हैं जो लोकल कोविड हॉस्पिटल में एडमिटेड थे, जिनको न्यूरोलॉजिकल सिम्टम्स या स्ट्रोक सिम्टम्स हुए. एक डिफरेंस जैसा ऑलरेडी हाईलाइट किया गया कि कोविड हॉस्पिटल में स्ट्रोक रेडी पाथवेज नहीं होती हैं, वहां पे एस्टैब्लिश स्ट्रोक टीम्स नहीं हैं, सो द क्वालिटी ऑफ स्ट्रोक केयर मे बी कॉम्प्रोमाइज्ड. सो टू फैसिलिटेट दैट, हमने हमारे यहाँ पे गुरुग्राम में जो कोविड हॉस्पिटल है उसके साथ टेलीमेडिसिन नेटवर्क एस्टैब्लिश किया है, जिसमें उसके आईसीयू को हम अपने आईसीयू से टेलीमेडिसिन से गवर्न करते हैं. उसमें कोई भी स्ट्रोक होता है तो उसके रिपोर्ट्स को हम टेलीमेडिसिन से इमीडिएटली एक्सेस कर सकते हैं, पेशेंट को वीडियो कॉल पे इमीडिएटली देख सकते हैं अगर वो हॉस्पिटल फिजिकली हमसे डिस्टेंट भी है, और ऑन टेलीमेडिसिन वहां के जो आईसीयू स्पेशलिस्ट हैं उनके साथ मिलके उसको दवाई एडमिनिस्टर कर सकते हैं. और अगर पेशेंट को थ्रोम्बेक्टमी या इंटरवेंशन रिक्वायर्ड है, जो कि कभी कभी कोविड हॉस्पिटल में करना संभव नहीं है, तो उसको अपने यहाँ पे सेफ पाथवे में विद पीपीज ट्रांसफर करके विद एडिक्वेट प्रिकॉशंस वी कैन डू दैट. सो इट इज पॉसिबल विद टेलीमेडिसिन also without wasting time to prescribe treatments and get them ascertained in COVID hospitals also, ताकि पेशेंट को टाइम का और बॉडी का और ब्रेन का नुकसान ना हो. As we have already said before, time is brain in stroke. So we have to evolve to modify ourselves to ensure that COVID patients also get similar service as the other patients get.
Dr. Gorti, मैं आपसे पूछना चाहती थी सर, आपने हमें बताया कि पेशेंट कोविड से रिकवर कर गए हैं और उसके बाद स्ट्रोक की वजह से आपके पास जब उन्होंने प्रेजेंट किया तो आपने देखा लार्ज वेसल में ब्लॉकेज था और स्ट्रोक था. तो आप क्या ये कहेंगे कि जिनको कोविड होता है उनको स्ट्रोक का रिस्क ज्यादा है? क्या करना चाहिए जब ट्रीटमेंट ले रहे हैं, ट्रीटमेंट के बाद क्या उनको करना चाहिए, कैसे सतर्क रहे कि वो पहचान पाए कि अब स्ट्रोक हो रहा है और जल्द से जल्द ट्रीटमेंट ले?
Yeah, this is a difficult question to answer because pandemic has started somewhere in December and it is ongoing, and we are seeing the results. We are gaining experience day by day. So looking at the follow-up of these cases right now, yes, there is a thought process, because the thrombus is forming mainly in the heart and big vessels. So anticoagulation can be considered as an option. No evidence so far. There are also, it is not an atherosclerotic problem, so antiplatelets are less likely to be effective in this case. And why this thing is happening is, there is something called in the viremia stage, the virus enters to the white blood cells and enters into the brain and damages the blood vessel. This is a Trojan horse hypothesis. So it can happen at any blood vessel, and stroke can happen. So the best way to prevent is maybe in future, when studies should tell us that oral anticoagulant medications like rivaroxaban to be taken or not yet established, but hypothesis is generated and more studies are going on. Right now we have to wait and watch, depending on the pathophysiology and the outcomes of the stroke and the recurrences, as we are going to see in the next 6 months, whether strokes are happening after the COVID recovery or not, and how much they are happening. So future time only will tell us what to do in future.
Right, definitely more studies and more data needs to be collected before we have a comprehensive understanding and then a strategy to deal with strokes that may happen because of being treated or being affected by the coronavirus.
But just a minute, I would just like to add one point to what has been already discussed.
Yes, ma'am.
Whenever a patient comes with a stroke and you find that the patient is not having any COVID symptoms and is being COVID positive, we also needs to understand that it may be just a silent bystander. We have got a lot of patients with diabetes, hypertension, coming to us with carotid stenosis and stroke. So that is not at all related to the COVID. So since now COVID is very common and we are getting a lot of asymptomatic patients, we need to consider that it may not be related to that, and it is just a patient with a high risk factor profile, older age patient is having a stroke, and at the same time the patient is COVID positive.
All right. We are getting a lot of questions from those who have been watching this show. So I'm going to take a few questions. One Facebook user is asking us, is there any remedy for paralysis? Dr. Gupta, would you like to take that question? Is there any remedy for paralysis?
So the best remedy for paralysis is prevention. So we have already discussed in this seminar that there are defined risk factors for stroke like diabetes, hypertension, smoking, excess alcohol, sedentary lifestyle, obesity. If we control them, we can, in 50% cases, prevent stroke. The second remedy for paralysis is early detection and knowing it in time. As we have reiterated, time is brain. So if you have stroke symptoms that have already been outlined, reach a stroke ready center fast so that your cells can be salvaged and you can be administered stroke breaking medicines or clot retrieval or mechanical thrombectomy so that your paralysis can be reversed even on table sometimes, which is the best possible treatment. If we are not able to get it still, and if we are late, still there are options with physiotherapy, medication, exercise, possibly reducing drugs. There are options for paralysis, and the neuroplasticity or the ability of brain to heal itself is immense. And a lot of patients, after hard work and diligent effort of attendance, can actually recover significantly in 3 to 6 months time from their paralysis.
Right. Dr. Gorti, एक और सवाल हमें आया है. What are the do's and the don'ts after convulsion attack?
स्ट्रोक मैनेजमेंट जो कोविड पैंडेमिक इरा में होता है और अदर, देयर इज नो डिफरेंस. ओनली थिंग इज द पेशेंट्स माउथ हैज टू बी क्लोज, दैट इज ही शुड नॉट, बिकॉज इट इज अ प्रोटेक्शन फॉर द डॉक्टर्स एंड पैरामेडिकल पीपल फ्रॉम द पेशेंट, बिकॉज जो पेशेंट आता है वो स्ट्रोक से आता है जरूर, बट हमको ये नहीं पता है कि वो कोज सिम्टोमेटिक है, हिस्ट्री है. टिल अभी जब तक हम एग्जामिन नहीं करेंगे हमको पता नहीं होगा. इसलिए टू प्रोटेक्ट ऑल द मेडिकल पर्सनल, पहले उनका मुंह के ऊपर मास्क डाल दीजिए। एंड हिस्ट्री लेना जरूरी है कि फीवर आया, कांटेक्ट हुआ, डेंजरस एरिया में आप जोन में आप ले रहे हो, सब लेके तो वेरी केयरफुली आपको एलिसिट करना पड़ेगा। और जब हम मार्च अप्रैल में जब केसेस देखने लगे, हमने डॉक्टर पूर्णिमा से बोला कि इस समय देखो केसेस कैसा आ रहा है, लार्ज वेसल अक्लूजन्स आ रहे हैं, क्यों आ रहे हैं समझ में नहीं आया। जैसे डॉक्टर शैलजा ने बताया कि हो सकता है कि viral is there in environment which is causing some changes. You know that there are about 60% of Indian population was found to be positive in one guesswork. So there is a chance that they may come with positive, they may have virus. So we have to be very careful. And whenever we get the CT scan करना है, उसके बाद सैनिटाइज करना है, वो एक डिले होता है हमेशा। जब सीटी स्कैन के लिए हम प्लान करेंगे, एमआरआई के लिए प्लान करेंगे, वो एक सेपरेट रूट में जाना पड़ेगा। प्रोटेक्टेड स्ट्रोक कोड एक इवॉल्व किया गया है, इसमें स्क्रीनिंग किया जाता है और सैनिटाइजेशन प्रोसीजर्स अडॉप्ट किया जाता है और आइसोलेशन किया जाता है। वंस इट इज एक बार वो तय हो गया कि एक कोविड पेशेंट है, वो अलग विंग में चले जाएगा, उधर का ट्रीटमेंट अलग होता है। तो ये ज़्यादा से ज़्यादा जो पेशेंट्स डॉक्टर्स या पैरामेडिकल स्टाफ को कोविड इन्फेक्शन देने का संभावना ज़्यादा है, नहीं तो देयर इज नो डिफरेंस इन मैनेजमेंट बिटवीन स्ट्रोक केसेस इन कोविड एंड नॉन कोविड। ये मेरा।
All right, Dr. Shalja, we've got another Facebook user asking us a question. Can endovascular therapy reduce the risk of stroke?
So endovascular therapy is treatment which is given to a patient once the patient has developed a stroke. What is endovascular treatment is, when a patient develops a stroke, about 30% of the patients who develop a big stroke will have a occlusion in one of the main blood vessels in the brain. So in those patients, the IV thrombolytic or the clot-lysing medicines are not very effective in them. And in these patients, only if the clot is very small, it will be lysed by the thrombolytic drug. Rest of all the patients who are having a main vessel occlusion will require thrombectomy, that is the endovascular treatment, whereby a catheter is put into the vessel and the thrombus is removed. So this is a treatment which is given when the patient is coming early into the time window of stroke, and you find that the patient has got a main vessel occlusion and the scan is very good, there is not much of damage already done, and you can remove the clot. And this is one treatment where the number needed to treat is very low. That means the chances of the patient recovery is to the tune of 50 to 60% of them make a very good recovery after a severe stroke. And one more point is that in these patients, we have a extended time window. So that is what has come up in the last 3 years. All the trials have shown that you have time up to 24 hours to treat with mechanical thrombectomy for patients who are having a large vessel occlusion. So there is no, it's not a preventive treatment, it's a treatment which is given once the patient develops a stroke and you have a clot in the brain, you remove the clot and you save the rest of the brain from going into further damage.
All right. There are two more questions, and I'll request Dr. Gupta if you can address both of these a little quickly.
Yes,
a Facebook user is asking, are strokes hereditary? And the next question is, can dress cause stroke? I mean, the way you dress, can that cause stroke?
So family history is an important risk factor for stroke. And it does not mean that somebody in your family had stroke, you will have stroke. But it tells you that you should take extra precautions to minimize your stroke risk, which means that you should measure your blood pressure more frequently. You should do a preventive health check so that you can prevent yourself from getting diabetes, pick it up early, treat early, avoid smoking, avoid access of alcohol, exercise regularly so that you are able to modify the modifiable risk factors for stroke. Second thing is dressing usually should not...
Sorry, Dr. Gupta, I got it a little wrong. The question is stress a cause of stroke? Not dress, actually, stress.
Okay. So coming to dress also first, actually if you don't dress properly and you move around in early winters, Like people in India like to take walk improperly dressed, that can also increase the risk of stroke. Coming to stress itself, stress is an important risk factor for many disorders because it changes the way our brain functions. Stress worsens hypertension. Stress worsens blood pressure. Stress causes people to become more prone to addictions like smoking and alcoholism. So stress worsens these stroke risk factors. Second, stress upsets the sleep rhythm, which is also an important risk factor for cardiovascular disease. Stress causes you to gain weight, which causes obesity, which is also an important risk factor for stroke. However, if the stress is mild and it can be handled, then mild stress itself is not a risk factor for stroke. And a lot of people mistake stress for hypertension. Hypertension is not tension. It is a blood pressure increase that happens on the walls of the arteries. So we must carefully take care of our stress to minimize our risk to our life.
All right. Thank you so much for coming on the show, on the Stroke Summit show, and enlightening everybody about how to manage stroke, what to do in the times of a pandemic, and what can be the impact that this pandemic has on people, whether it increases their risk of getting a stroke. Dr. Shailja, Dr. Gorti, Dr. Gupta, thank you so much for taking the time out today and joining us in the Stroke Summit.
Thank you, Anisha. Thank you.
Thank you, Anisha.
Thank you. So given the high incidence of stroke cases in our country and how the ignorance about recognizing the symptoms, we need to act now. Yes, at a time when the nation is fighting a pandemic, resources are already overstretched, but no illness will wait for the pandemic to be over. From awareness programs for enlightened citizenry, frontline healthcare workers, ambulance staff, to healthcare and rehabilitation providers, devising an integrated stroke strategy is the need of the hour. So we've heard the survivors and the experts talk to us about stroke and how to put all the pieces of this puzzle together to fight stroke. Now, the IHW Council is dedicated towards creating awareness about good health and healthcare systems in our country. Do give us your feedback on what you have learned during the Stroke Summit that we have done today by typing in your comment section. Do also share the IHW Council page with your friends and family so that they also benefit from the expertise of the very knowledgeable doctors and experts who share their wisdom with us nearly every day. We do a lot of awareness campaigns for many of the diseases, and stroke is certainly a very important disease, and it is amongst the biggest reasons for causing disability amongst young productive people in our country. We would like to thank all the doctors and the survivors for taking the time out and joining us during the Stroke Summit today. Thank you so much for your time, and goodbye.
Thank you.